Now let me turn to 1B that we announced last week. Where our deaths have been the greatest, of course, are among our older members of Ohio society. And Eric, if you can put that up, please. And again, you start at the bottom here. Plus 80 is 53% of the deaths. So 53% of the deaths, 80 plus. 75 to 79 is 14% of the deaths. Age 70 to 74 is 11.9, almost 12. 65 to 69 is 8. 60 to 64 is 5, and on. So we've had people die at almost every age, but if you look at the statistics, the most vulnerable individuals obviously are the older that they get. So again, that I think gives us a pretty good indication of why we're in 1B. We're going to start with older people, and we hope in approximately 2 weeks from now to be starting in. A lot of this depends on how much we're getting in from the federal government, et cetera. But we hope in about 2 weeks to be starting in on this 1B group. Just again to give you some numbers. Above 85 is about 220,000 people. 75 to 84 is about 580,000 people. And 65 to 74 is 1 million people. We also have announced that in the 1B group, we will have approximately 75,000 people who are the most at risk because of a medical condition or situation, who are under the age of 65. And that comes, as I said, to about 75,000 people. But we also have another group that potentially is as large as 300,000. That is people who work in our schools K through 12. So we'll be announcing in the next few days how we're going to phase those in. But those are the groups that will be coming up after 1A. Now, to clarify it, some of 1A will be finishing up next week, some the next week after. But some of 1A will continue on for some time. For example, assisted living. Our pharmacy partners will go to assisted living as soon as they get done with the nursing homes. But then by the time you get that second shot for people in assisted living, we're down the road a few more weeks. So 1A will continue to some extent down here. At the same time, we start up 1B and go that way. So I hope that brings a little clarity to what we're doing. But again, the goals are clear. Number one, most important thing is to protect lives. Number two, protect our healthcare workers who are protecting us every day. And three is get our kids in school. Those are the goals. That's what drives everything we're doing.